Feminist, liberator of women's bodies, eugenist, murderer. These are but a few terms that have been used to identify Margaret Sanger. However, the truth is more complex than these few short terms convey. Born Margaret Louise Higgins on September 14, 1879, in Corning, New York, Margaret began life very interested in education and knowledge. In 1896, she attended Calvary College and began training as a nurse at White Plains Hospital in 1900. By 1911, she had moved to New York City with her husband, architect William Sanger, and their 3 children. It was during this time she began working as a nurse in the Lower East Side of New York and became exposed to the harshness of life for women who lived in these areas. One of the major problems women faced at the time was a lack of knowledge about contraceptives due to the passing of laws such as the 1873 Comstock Act that prohibited the dissemination of facts about birth control and birth control devices due to the fact they were seen as obscene. To fight this measure, Sanger began to write publications such as the Women's Rebel to inform women about contraceptives and distribute birth control devices to help impoverished women avoid unwanted pregnancies. Due to fear of prosecution, however, she fled to Europe in 1914, but eventually returned in 1915 and opened the first birth control clinic in the United States in 1916. She was arrested soon after violating the Comstock Act, however, but an appeal in the case eventually led to the courts allowing doctors to prescribe birth control devices to women for medical reasons, one of the first major victories Sanger experienced in this movement. By 1921, Sanger founded the American Birth Control League to bring middle-class women into the birth control movement fold. She also used the league to found the Birth Control Clinical Research Bureau in 1923, the first legal birth control clinic in the United States. Despite her continued advocacy of the movement, she was eventually forced to retire in 1940 and moved to Tucson, Arizona. Despite her retirement, she also helped to found the International Committee on Planned Parenthood in 1946 and helped to fund the creation of a birth control pill called Enovoid in 1960. Margaret Sanger eventually died on September 6, 1966 in Arizona, a year after birth control was finally legalized in the United States case of Griswold versus Connecticut in 1965, allowing her to see the fruition of her 50-year fight for birth control and women's rights. Despite her many victories, her legacy remains a controversial issue. Many second-wave feminists see Margaret as a liberator, due to her stance on women's bodily rights, as often seen as a first step for equality in other areas such as in political and public realms, and opened new doors for women beyond the household and as a maternal figure. However, those against abortion often find fault with Margaret due to her creation of Planned Parenthood and the many abortions that have been conducted since then. Many also cite her connection to the eugenist movement for reasons of concern, such as quotes in her book Women in the New Race, in which she described birth control as nothing more or less than the facilitation of the process of weeding out the unfit, of preventing the birth of defectives or of those who will become defectives. Despite her racist and eugenist tendencies, many women still find a reason to honor Margaret today. The International Honor Quilt, which was constructed to honor women who have been forgotten in history and who deserve to be recognized for their accomplishments, has also honored Margaret Sanger. The woman who created the panel for Margaret claimed to be inspired by Sanger due to her struggles with pelvic inflammatory disease, or PID, which is caused by sexually transmitted infections. Due to Sanger's work with promoting the use of contraceptives, this woman felt the need to honor Sanger by creating a quilt panel that showcased a diaphragm in the middle of the panel with the words Dutch Cap, Planned Parenthood, and Birth Control surrounding it, thus signifying Sanger's work with the creation of these institutions and the promotion of these devices. This panel thus represents how Sanger continues to impact the United States and how her legacy lives on.